Janssen has a really strong history in haematology and in multiple myeloma, but we were already in haematology since 1988. So when we think about the value that the new therapies, the new immunotherapies are bringing, we're bringing more life to patients. We're bringing better life. We're bringing a longer duration of the order of years. We're giving them hope. And patients know that we're not going to stop until we find a cure.
The scientific knowledge behind the disease of multiple myeloma itself alone is evolving exponentially. What we know about the condition now versus what we knew years ago, even actually 2 or 3 years ago, has significantly increased. So we're continually discovering new molecular targets for the condition, which means that new medicines are being developed at a fairly rapid pace.
Medicine has evolved, science is always changing, and we're certainly in Janssen at the forefront of bringing innovation to myeloma patients with the hope of a cure in the not too distant future.
When I first started practicing as a junior doctor, the treatment of multiple myeloma was really poor. We had nothing that was any better really than old-fashioned oral chemotherapy. The median survival of patients at that time was about 3 years. And so, now we have a wealth of new treatments for patients with multiple myeloma. I have seen, us go from a situation where we had very limited options to a vast menu of different options that are available.
So we've gone from a 27% survival rate in the 90s to over 70% right now. And that's as a result of all the new treatments. We've got great improvements, but there's still lots more that we can do. So seeing research and seeing new drugs develop is really, really important for our patients.
When I first started, the conversations with newly diagnosed patients were very difficult, especially if we were dealing with a younger patient, because if you were talking to them and telling them that the median survival is roughly 3 years, that unfortunately myeloma causes a lot of bone disease as well, and we didn't have good drugs even at that time to reliably tackle bone disease, that they had a life in front of them where we could at best control the disease. But for those patients to know if they achieve a really deep response that it's likely to result in a meaningful prolongation of their life, that they'll now have the opportunity to see their kids grow up, go to college, graduate, get married, that they'll get to play with their grandchildren. All of these things are, it's frankly just a whole different ballgame compared to when I started.
There are a few patients that I've come across in Ireland, in the UK, where they've only got about a year of remission, but still we're getting letters back to say thanks for the extra few months. And these are letters coming from families. They're coming from husbands and wives. They're coming from children. So while we're doing a great job, I always remember what one of the ladies said to us in the US who had myeloma and who had 19 lines of therapy. Please try harder. Please continue to try. So every time I think we're getting closer to that 100%, I know there's patients sitting out there that need more. So that really gives us the drive to go and get that cure for patients.
The journey never stops, and myeloma is still a terminal illness. We would be quite confident with the clinical data we're seeing and the innovation that Janssen is producing in the field of myeloma that there is a really strong hope of a cure in the not too distant future. And certainly we would like to be at the foundation and the backbone of getting to that holy grail, which has always been the case of a terminal illness.